All right, thank you. Well, speak to us. You're welcome, Your Excellency. Thank you
very much. Please take your seats. Thank you. Yeah. Thank you very much. Thank you. The Honorable thank you very much. The Honorable Minister for Health, Dr. Bennett Okuboy, Chief Director, Ministry of Health, Alhaji Hafiz Adams, the Director General of the Ghana Health Service, Dr. Patrick Kumaboj Abuaji, the Acting CEO of Kolebu Teaching Hospital, Dr. Usu Secretary, the CEO of Lightwave eHealth Solutions, my brother Mr. Sapson Jabba, Directors of Kolebu Teaching Hospital, development partners, our incoming Member of Parliament for Ablekuma South, Honorable Teacher Abu, hard-working healthcare staff here, Nime, Name, friends from the media, distinguished ladies and gentlemen, good afternoon. I am honored for this opportunity to join you as special guest of honor on this historic day, and it is a historic day, to commission the National eHealth Project today. I've been looking forward to this day, and I'm grateful to God for bringing us this far. Ladies and gentlemen, the fourth industrial revolution has propelled significant technological advancements that have reshaped societies, including their healthcare service delivery systems, and so on. However, most developing countries, Ghana included, have in the past not been able to adequately harness the opportunities this digital revolution presents. This narrative is, however, changing under the MPP government's digitalization agenda, which I have been championing over the past 8 years. Through the government's resolve to change this narrative, I have spearheaded several initiatives aimed at leveraging digital technologies to enhance governance, service delivery, revenue mobilization, tackle corruption, and enhance financial inclusion and innovation in Ghana. Notable among some of these initiatives I've championed include the Ghana Card, the Digital Address System, and the Ghana Post GPS and mobile money interoperability. Additionally, I've championed the Universal QR Code Payment System, the Paperless Port System, and the Ghana.gov e-services project. In the health sector, I've championed initiatives such as the Ghana Card at Birth project, the National e-Pharmacy platform, the digital renewal for the National Health Insurance subscribers, the Zipline drone-based medical delivery project, and the Lightwave Health Information Management System of the National eHealth Project, which we are commissioning today. And these have revolutionized various sectors of the Ghanaian economy. Distinguished ladies and gentlemen, I am very, very happy today. This is really a great day for Ghana. As you have heard, we confronted a major problem of lack of accessibility by the medical practitioners to data and to timely data on patients. You have the missing folder problem that Dr. Okuboy, talked about, and you saw the state in which the folders were being kept, in how dark some of the places were and how difficult it was to retrieve some of these folders. And you could go to the hospital and you'll be told your folder was missing and they couldn't find it. And you had this problem, and you had also a problem of a lack of networking of the hospitals. And these were problems we had to attack and settle and resolve, amongst others. So ladies and gentlemen, I'm very excited by this LIMS initiative because an integrated electronic medical record system is crucial for a country's healthcare infrastructure. Electronic health records, such as LIMS, consolidate patient information across healthcare providers, enabling a more coordinated, efficient, and safe approach to patient care. Deployment of the LIMS application as part of the National eHealth project over the last 6 years has been instrumental in delivering efficient and effective healthcare in the country, improving health processes and infrastructure across public health facilities. Ladies and gentlemen, in 2017, the MPP government, through the Ministry of Health, engaged Lightwave eHealth Solutions Limited to pilot the National eHealth project as part of the National Digitalization agenda in the Central Region. Following a successful pilot of the project in 2018, approval was given for the commencement of Phase 2 in 2019. This phase, which is currently ongoing, has seen the deployment of the LIMS in about 481 health facilities made up of all teaching, regional, district, polyclinics, and psychiatric hospitals across all the 16 regions, and we are ongoing at health centers. This means that currently all the bigger health facilities in Ghana, which are the 6 teaching hospitals, 10 regional hospitals, 243 hospitals, 3 psychiatric hospitals, and 50 polyclinics are all deployed with LIMS, with over 1,000 health centers deployment currently ongoing at the moment. This is really massive when you think about it. So today, as you were told, if they refer you from Wa or Joaboso to Kolebu, you don't need a folder. You just need your ID number. And when you get to Kolebu and you meet Dr. Usu Secretary, he puts it in the number in the system, all your medical records will appear, whether you are from Joaboso or Wa or Tamale. And that is very, very good for healthcare in Ghana. Ladies and gentlemen, the impact of this project on health service delivery has been tremendous so far, as you have seen from this. Prior to the deployment of LIMS, there were challenges with easy and timely access to patients' health records, portability of patient records from service point to service point, legacy silo systems, inability to track and process revenue, manual process for NHI claim submission, and limited data for decision making at the various levels of health administration. Ladies and gentlemen, the days where patient records and case history existed in silos are no longer with us. Because of the introduction of the LIMS application, this has facilitated patient record portability to any LIMS site, which assures continuation of care without the patient having to maintain and transport his or her folder across different health facilities. It's also eliminated paper patient folders, elimination of folder container and storage space costs, availability of real-time data at the point of care, improve revenue accuracy. You've seen some of the hospitals are saying that, you know, their internally generated funds, in fact, tripled or doubled as a result of this system. You have also easy and accurate submission of NHIS claims, and this system really reduces fraud in NHIS claims because the whole system is networked and you can track the movement from hospital or department to department. Hospitals and health centers running LIMS have reported average improvement of revenue of about 30%, with a 35 to 40% improvement in patient wait times, whilst regional and teaching hospitals are reporting over 40% improvement in wait times. Ladies and gentlemen, the deployment of LIMS has improved access to actionable epidemic information in a timely manner. And you know how devastating an epidemic can be to the economy. It can be really, as we saw with COVID, it can be totally devastating. And so the key is timely information so that action can be undertaken. The purpose of real-time surveillance is to advance the safety, security, and resilience of the nation by leading an integrated biosurveillance effort that facilitates early warning and situational awareness of biological events. LIMS has demonstrated that it is capable of tracking and alerting symptom sets of data in real time to the disease surveillance team. The impact on reaction times for controlling disease outbreaks is enormous. Enacting response measures such as quarantine and isolation protocols change from days or weeks to minutes or hours. Here it is worth noting that savings from early detection of disease outbreaks has the potential to decrease the medication budget of Ghana. This model can be expanded to other diseases so that medication budgets can be better and purchases of medication made at lower prices. As we are all aware, drugs and pharmaceuticals constitute about 40% of the total health budget, and drug sales make up 50% of the health revenue. Cost containment measures supported by the project has improved efficient management of total drug inventory. Ladies and gentlemen, the LIMS solution allows for real-time validation of a patient's NHI insurance status, confirming a patient's coverage eligibility at the time of registration saves time and money by eliminating claims from uncovered patient visits. LIMS builds the NHI claim at each point of service during a patient's visit. This means the claim is prepared when the patient encounter is completed. All completed claims are ready for review and submission based on facility process. This has greatly improved filing time and accuracy. In fact, NHIA reported nearly a 30% cost savings due to improvements in accuracy and timely filing at sites running the LIMS software. Yes, you can clap for them. Because the LIMS application checks the claims rules At each point of service, inaccuracies are being detected immediately. Where the e-health project has already been deployed, healthcare administrators can track some core parameters such as the availability of beds, nearest access to specific tests and medical services, availability of specialists, and load on inpatient and emergency wards. A real-time dashboard with these parameters being tracked along with 40 other useful parameters for public health teams is already deployed for use. Ladies and gentlemen, the National e-Health Project has been deployed as a holistic healthcare platform. Real-time data collection from connected LIMS facilities has provided health stakeholders and disease control experts a unique opportunity to enable health policy decisions for the entire health continuum in a manner never envisioned before. Ladies and gentlemen, as security and reliability are critical for any mature EMR application, the LIMS application has been developed on 3 pillars of security, reliability, and availability. So all electronic medical records have to be built, around security, reliability, and availability. It is encrypted, shadow copied on multiple secured servers, locally available at facilities, so internet downtime and unavailability do not cause problems with patient care. LIMS is also capable of maintaining the provision of care remotely using real-time backed up data in event of a local failure. This bidirectional feature of the LIMS system provided the greatest opportunity for a successful patient outcome. Again, the rollout of the LIMS application has become the main backbone for integration of all other services and operations at health facilities deployed on the LIMS. On-site banks across these facilities have been successfully integrated with LIMS to facilitate cash payments, reduce wait times at cash counters, and improve visibility of funds at the hospitals. Diagnostic equipment such as analyzers are all integrated at the various health facilities with the LIMS to ensure end-to-end data flow for decision making. Ladies and gentlemen, one initiative I launched last year is the issuance of Ghana card number at birth, which is integrated with the LIMS application as the main patient health record system for capturing of baby and parents' details at the various hospitals. And so under the Ghana card at birth, when the child goes for weigh-in, at that time the child is able to be given at the point of weigh-in a Ghana card ID and a birth certificate ID at the same time. So that was a major reform that we brought in. The National Electronic Pharmacy platform, which I also launched in 2022, which seeks to ensure a safe and secure access to medications and pharmaceutical services in the country, is also integrated with the LIMS for drugs data at the various facilities to ensure continuum of care. One of the big advantages of what we have done with LIMS is that it really provides us a very solid foundation for telemedicine in this country. And so you're seeing NHIA beginning to put in place the telemedicine architecture for this country, and it's going to save the health service a lot of money and free up time, because there are a lot of patients who don't really physically need to go and see a doctor, and they could see the doctor from home remotely and leave more patients who need to see doctors personally the space to do so, and it will
unclog the waiting time. So I think the telemedicine and the future of telemedicine really is upon us with the limbs that has been now done. In fact, I at this point want to especially thank and congratulate the CEO of LifeWave E Healthcare Solutions, Mr. Samson Jaba. Please take a bow. This man is a bit special. He's a bit special. He's brilliant. He's brought his knowledge, which is global. He's a global player. He's brought his knowledge to help this country, and I'm so proud of him for what he's doing globally and what he has helped us do in Ghana. I think that he deserves a round of applause. The LightWave team, they really deserve a round of applause, because a lot of the time we just see the end product, and we are not concerned about how it came about. But a lot of sleepless nights, many sleepless nights. I've been on the phone several times with Mr. Jaba at various times as we move this project through to get it done. But they have been very professional and very patriotic. They wanted Ghana to achieve what we have achieved today, and I want to thank him and everybody. I want to thank all the other players, the Ministry of Health, the Ghana Health Service, the health facilities that have all participated in this. It's been a collective effort, and I'm really proud as a Ghanaian with what we have done. Not many countries on the continent have done or have been able to do what we have done, and I really am looking forward to us leveraging all of this health solutions to do greater things for Ghana. Ghana is moving to bigger things. On Friday, I want to note that Ghana will launch 5G on Friday. 5G. We are moving to 5G, which is a major, really major undertaking for our country. And 5G changes so much for the digitalization agenda, because the speed of 5G is 100 times the speed of 4G. 100 times. So faster downloads, faster uploads. And you look at 5G, and it has 1,000 times more capacity than 4G. So it's got capacity for hundreds of thousands of devices working seamlessly and communicating. It is set to transform sectors like the health sector. 5G and what we are doing, this is really going to be helped. I mean, what we have done with e-health is going to be really helped with 5G. Health wearables, for example, are able to reliably transmit data in real time to medical professionals. And so you will be able to get into a situation where you can transmit data from yourself to your doctor, and he'll be able to say, look, maybe you're about to have a heart attack and we better get you to the hospital. Well, sitting you are thousands of miles away. So we are in a whole new era with 5G coming in. So we're going to continue building on this. At this point, ladies and gentlemen, permit me to acknowledge all of those who have helped to make this possible. And I wish to take this opportunity to commend the Honorable Minister for Health, Dr. Bernard Okuboy, and his predecessor, Dr. Kweku Ajimamenu, who was was working very hard on this project, as well as the Ministry of Health and the Ghana Health Service for successfully organizing this event along with Lightwave, and to look forward to the completion of deployment at the health centers and the CHIPS compounds and private facilities to facilitate better patient outcomes and healthcare delivery across the country. I believe Ghana has reached a major milestone today, and I keep saying it is possible. Thank you very much. Thank you for your attention. God bless you.